Good morning, members and guests. Thank you for attending today, and I thank the moderators and sages for the opportunity to present our research on anti-scarring agents in the prevention of post-esophageal endoscopic submucosal dissection strictures. We'd also like to thank SAGES for supporting this research, and this is the rest of our disclosures. Esophageal endoscopic submucosal dissection, or EESD, involves endoscopically removing the mucosal layer and keeping the submucosal and the muscular layers intact. It is an effective, less invasive way of treating intramucosal esophageal cancer and high-grade Barrett's dysplasia. Compared to EMR and ablative technique, it provides a larger intact tissue specimen for more accurate histopathologic analysis and decrease the risk of undertreatment. Unfortunately, post-EESD strictures are very common. Though multiple treatment modalities are available for treating esophageal strictures, they all lead to a poor quality of life and increase the mortality and morbidity of the procedure. We do know that circumferential and large mucosal defects are more prone to esophageal strictures. So we hypothesize that the application of anti-scarring agents will decrease the degree of post-esophageal esophageal strictures. Strictures are due to a post-traumatic fibrosis, wound contracture, and scar formation that occurred during normal healing. Adult wound healing consists of 3 phases: inflammation, proliferation, and remodeling. Modification during any of these 3 phases can decrease the degree of fibrosis, contractures, and scar formation. In this study, we've used 3 anti-scarring agents targeting different phases of wound healing. The first agent is halofuginone. It is a plant alkaloid that inhibits type 1 collagen synthesis. It's been experimentally used for a number of fibrotic diseases, including esophageal strictures after caustic injury. The second agent is transforming growth factor beta 3. It is a cytokine that is found in abundance during fetal wound healing and has been experimentally effective in preventing scar formation after mucosal injury, vocal cord injury, dermal wounds, and rotator cuff surgery. It's also been found in high levels after adipocyte stem cell therapy. Lastly, we have Mitomycin C. It's a DNA cross-linker with both anti-metabolite and anti-proliferative properties. It inhibits fibroblast proliferation, reduces scar formation, and wound contractures. It's been used clinically and experimentally for many scar-inducing problems, including esophageal stenosis after caustic or radiation injury. To explore these effects, we use a previously described pig model. A total of 20 pigs undergo EESD that resulted in an 8 to 10 centimeter long circumferential mucosal defect. The control pigs did not receive any anti-scarring agents, and 2 pigs are allocated to each agent dosage groups. The drug was then administered as 40 evenly distributed injections immediately post-procedure and then repeated on week 1 and 2. If the strictures were too tight to pass the scope, the agent was not applied. The dosages of the agents were derived from previously published studies. Our primary endpoint was the degree of stricture. This was calculated by measuring the esophageal luminal diameter and stricture length on weekly barium swallows and endoscopic assessments. Because this was an exploratory study, no statistical analysis was performed. The animals were euthanized if the esophageal lumen was reduced by greater than 80%, they were unable to eat or maintain weight, or at the end of the study. Our model reliably created a post-EESD esophageal strictures. All of the control animals developed significant strictures and were euthanized by week 3. In week 1, the median luminal reduction was approximately 63%, and it increased to 78% by week 2. Only 2 of the 6 animals survived into week 3. In the halofuginol treated group, all 3 dosages showed some mild therapeutic effect. In the middle dose, 1 pig survived to week 3 and 4, while in the high dose, both pigs survived into week 3. In contrast, TGF-beta 3 did not seem to have any effect on post-EESD strictures. Mitomycin C demonstrated the most dramatic therapeutic effect. Looking at week 2 in particular, the control animals again had 78% luminal reduction, and low-dose mitomycin C only had 54%. One animal survived into week 3 and 4, and the esophageal lumen was maintained. Though the curve for the high-dose mitomycin C group is even more encouraging, one animal did die of an esophageal perforation at week 3, so when the second animal showed a similar endoluminal findings, it was euthanized early at week 2. The fluoroscopic and endoscopic exam confirmed the clinically significant stricture reduction. However, progressive proximal esophageal dilatation was still observed. On gross inspection, the control pig and the low-dose mitomycin C pig showed evidence of reepithelialization, but the high-dose mitomycin pig had transmural perforations. So in summary, this is an exploratory study, but the effects of anti-scarring agents of post-ESD stricture formations have been mixed. TGF-beta 3 appears to have little or no effect. Halofuginol may have some mild effect, and low-dose mitomycin C had the most significant effect. However, high-dose mitomycin C did result in an esophageal perforation. The study does have some limitations. Though encouraging, these are still preliminary results, and more animals are needed to determine the true effect of the anti-scarring agents. In addition, during the study, we also identified some issues with drug delivery, and we still need a reliable, safe, and endoscopically applicable delivery method for these drugs. So in our lab currently, we're creating a sustained release drug-eluting stent to try and address this issue. In conclusion, injection of halofuginol and 0.05 milligrams milliliters of mitomycin C to the post-ESD restriction bed shows promise in reducing esophageal strictures, and caution should be used with higher dosages of mitomycin C due to the risk of transmural perforation, and further studies are needed to determine the true effect of these anti-scarring agents and to determine the best delivery method, duration, and dosages. Thank you very much for your attention.